Hi, I'm Dr. Jody Enright. I'm the Medical Director at the Moncton Hospital. I want to tell you a little bit about what we've been doing in terms of testing for COVID-19 as part of our response to this pandemic. Horizon, across all sites, has developed assessment clinics to facilitate the testing of patients who meet the criteria. And we've done the same thing here at the Moncton Hospital. The process works by patients calling 811 or their family docs to be assessed to see whether or not they meet the testing criteria for COVID-19. Currently, the testing criteria includes symptoms, so the person has to be symptomatic with a fever and or a cough, plus some contact with the virus. That can be the person has traveled in the last 17 days internationally, or they've come into contact with a sick traveler who's traveled in the last 14 days. And of course, anyone who has been in direct contact with a proven case of COVID-19 also qualifies. So if someone has symptoms and has a link to the virus, then they should be tested. As I mentioned, they can call 811 or their family physicians to be referred to our clinic. We have set up a very smooth process for screening. We get the referral, we call the patient, ask a few more questions, and book an appointment. From there, the patient is directed to our site. They come in, most of them stay in their car, and our staff go out, healthcare professionals go out to assess them in the car and perform the swab there. Most people leave after that. It's a very smooth process. If patients are not as well and need to be assessed by a physician, then they're brought into the clinic. This part of our response to the pandemic is important. We need to know if we have patients with COVID-19 in our community to be able to help stop the spread. So I'd urge any of you who have symptoms to contact 811 or your family physician's office to let them know and see if you qualify for testing.